Welcome, everyone, to Delay Depose, Health Over Wealth.
Glad to be back, ready to dive into the mess that is healthcare and how it's all changing, hopefully for the better.
Happy to be here. Always interesting to unpack these complex issues. Let's see what kind of solutions we can find today, within the existing framework, of course.
Existing framework. I'm hoping we're talking about solutions outside that framework, honestly. We need a fundamental shift, not just tweaks, but first, what news is catching everyone's eye this week?
Well, this SNL skit with Cecily Strongback as Jeanine Pirro, I know it's satire, but it hits a nerve. Trump appointing her interim U.S. attorney, it just feels like a commentary on how unqualified people are getting into positions of power, you know? And in healthcare, that translates to, well, everything we talk about on this show.
It's entertainment, designed to get a laugh. Government hires people into key positions all the time that causes concern and generates debate. What does this skit have to do with healthcare specifically?
I think the point is less about the specifics of that appointment and more about the general erosion of standards, right? In healthcare, we see that with profit motives overriding patient care. Like, how many times have we talked about insurance companies denying claims based on flimsy reasons, or hospitals prioritizing lucrative procedures over preventative care?
Exactly. It's about the why behind the decisions. Are we optimizing for human well-being, or are we optimizing for shareholder value? And let's be honest, the answer lately is usually the latter, which is why someone like Mangione, takes drastic action, not condoning it, but understanding it.
Hold on, let's not jump to justifying violence. I think we need to be careful connecting isolated incidents to broad systemic issues. Like with United Healthcare's CEO assassination and Mangione's motives, you really think there is a grand correlation?
I think it is a symptom, don't you? Think about the desperation that leads someone to that point. It doesn't happen in a vacuum, right? It is a system designed to make people feel unheard, and the fact that there's even a segment of the population sympathizing says a lot, a whole hell of a lot. It reflects the broader frustration with the healthcare system and the feeling that it's rigged against ordinary people. If it truly delivered quality care at a reasonable cost, then the response might be different.
And this SNL skit, while funny, is also poking at that same nerve. The feeling that the people in charge are out of touch, unqualified, or actively malicious. It's not just healthcare, it's everything. It's a crisis of faith in institutions, and that bleeds into healthcare decisions all the time. Look at the regulations. They are filled with ways to exploit the system, so the average person just gives up.
Okay, but the problem isn't necessarily lack of qualifications, maybe. It is inexperience. Like, sure, someone might be on TV, but that doesn't mean they understand the nuances of complex policy or healthcare administration. And those nuances are crucial. It is like, you can say profit is bad, but it is the only things that provides a reason to advance things.
Oh, the nuances. That's what they always say, right? It's complicated. Sure it is. But that complexity is often deliberate, designed to obscure the fact that at its core, the system is prioritizing profit over people. How many people do we know who don't seek help because it is so expensive? How many people choose what to treat because of money?
It's not that profit is inherently evil, I think. It is about the balance. We need a system where making money doesn't come at the direct expense of human lives. And right now, the scales are way, way off.
I agree, profit isn't evil. The Kardashians have made a huge profit selling makeup and clothes. It is a successful venture. I saw an article about Khloe Kardashian wearing the same outfit as her mom, but it's like, how can we make the existing system more efficient? How can we streamline processes, reduce administrative overhead, and leverage technology to lower costs without sacrificing quality?
Streamline and efficiency can be code for deny more care. Look, administrative overhead is a problem, sure, but it is a symptom, not the disease. The disease is a system designed to extract wealth from sick people. You can't streamline that into something ethical.
And you can't just slap some AI on top of a fundamentally broken system and expect it to magically fix everything, right? I mean, algorithms are only as good as the data they're trained on. And if that data reflects existing biases, then you're just going to automate those biases and make the problems even worse.
That is an interesting point because they all are about to be biased. The news article about Brooklyn Beckham and Nicola Peltz, but like AI models that use historical data, for example, might perpetuate discriminatory practices if they are not careful. This article highlights that family issues exist. In the healthcare system, what happens when they start judging people's family history?
Exactly. Imagine an algorithm trained on data that shows, say, black patients are less likely to adhere to medication regimens. That's a real bias that exists because of systemic issues like lack of access to transportation, distrust of the medical establishment, and historical discrimination. But if the AI just sees black patient equals sign low adherence, it might automatically deny them certain treatments or flag them for more intensive monitoring, perpetuating the cycle.
Yeah, it is like, imagine an AI deciding who gets an organ transplant. If it's trained on data that reflects socioeconomic disparities, it might unknowingly favor wealthier patients who have better access to preventative care and are therefore deemed healthier candidates, even if the poorer patient is just as deserving and would benefit just as much from the transplant.
Right, but how do we fix it? I mean, we can't just throw out AI altogether. It has the potential to revolutionize healthcare, improve diagnoses, personalized treatments. We need to find a way to mitigate those biases, to make sure the algorithms are fair and equitable.
I think the first step is acknowledging the problem and being really intentional about data collection, making sure we're not just feeding the algorithms biased information in the first place, like actively seeking out data from underserved communities and oversampling populations that have been historically marginalized, actively trying to correct for existing inequalities.
And it's not just about the data itself, it's about who's building the algorithms. If it's all the same type of person, then it's even more bias. You need diverse teams with different backgrounds and perspectives to identify and challenge those biases. And you need transparency. We need to be able to see how these algorithms are making decisions so we can hold them accountable.
That's a great point. The recent article discussing Meghan Markle and Prince Harry's trip to Nigeria makes a good analogy. A lot of people saw them as being great people, but then you had the royalists that were not having it. No matter what, there is always going to be some form of bias. Algorithmic transparency is essential for accountability and public trust.
Transparency is key, but transparency without teeth is just window dressing. I mean, so what if we can see the algorithm is biased? What recourse do we have? We need regulatory oversight. We need government agencies or independent bodies to be able to audit these algorithms, to identify biases, and to force companies to correct them. And those regulations need to have some bite. Fines, penalties, something that actually disincentivizes bias.
Absolutely. And it's not just about the big, flashy AI algorithms used in hospitals or insurance companies. It's about the smaller, more insidious biases that creep into everyday healthcare decisions, like the way doctors might unconsciously treat patients differently based on their race, gender, or socioeconomic status. Those biases are everywhere, and they add up.
Okay, so if we can get past all the ways we could be hurt, what about education? Training healthcare professionals to recognize and address their own implicit biases. That's got to be a crucial component, right? If they learn it, they can be better.
Training is a start, but it is not enough. You can't just tell people to be less biased and expect the problem to disappear. These biases are deeply ingrained, and they're reinforced by the system itself. You need structural changes to address them.
Like, what? I mean, besides tearing down the entire healthcare system and starting over, which I'm obviously in favor of, but what concrete steps can we take right now?
One thing, expand access to preventative care. Make it free and universally available, because right now preventative care is a luxury for the wealthy. If everyone has access to it, then you start to level the playing field and you reduce the likelihood that those biases will influence treatment decisions down the line.
That's ambitious. How do you pay for it, especially when healthcare costs are already so high? Remember the luxury hotel article? It talked about the prices starting high, then having cheaper prices when things aren't as lavish. Maybe scaling that down to hospitals could work.
There's always money for war, but never for healthcare, right? We could start by cutting military spending, taxing the wealthy, and closing corporate loopholes. It is not a matter of can we afford it, it is a matter of do we want to. Do we value human lives enough to prioritize healthcare over profit?
And we need to rethink the way we reimburse doctors and hospitals. Right now, they're incentivized to perform more procedures, to order more tests. We need to shift the incentives towards preventative care, towards patient outcomes, towards keeping people healthy in the first place. Capitation models, paying doctors a fixed amount per patient, regardless of how much care they provide, can help with that.
But that could lead to undertreating patients. Doctors cutting corners to save money. We need to be careful about unintended consequences. What do they do now with Medicaid and Medicare? If more and more people retire, how can the system hold up?
That's why you need strong regulatory oversight. You need to be monitoring those outcomes, tracking patient satisfaction, and penalizing doctors who are providing substandard care. It's about creating a system of checks and balances. where the incentives are aligned with patient well-being, not just profit margins.
Another thing, address the social determinants of health. Healthcare isn't just about what happens in the doctor's office. It is about poverty, housing, food security, access to education. All those things have a huge impact on people's health. You can't fix healthcare without addressing those underlying inequalities.
Okay, but that's a massive undertaking. It is not just about healthcare, it is about fundamentally restructuring society. Is that realistic? It also needs to be a societal goal.
Well, yeah, that's the point. Healthcare is a societal issue. It is not just an individual problem. It is a reflection of our values, of our priorities. And right now, our values are messed up. We're prioritizing profit over people, and it's killing us. Literally.
It is about creating a more just and equitable society where everyone has the opportunity to thrive, and that includes access to quality healthcare regardless of their race, gender, socioeconomic status, or zip code. We have to get there. I think the discussion will only get louder until something is done.
I will say that it is also difficult to improve access to healthcare for everyone while maintaining a healthy, market-driven economic climate. There needs to be profit, or it is not feasible.
Healthcare really has to have this massive overhaul. And Mangione, he isn't a criminal. He is a martyr. Society is just moving in a different direction.
Agreed. Healthcare needs massive overhaul. We need to optimize the system for people, not profit. Thanks for the discussion.